Hi students, today we're going to be talking about Chapter 6, which covers sensory impairments of both hearing and vision. Think about what you already know about these concepts from our objective. So the first one is, you should be able to, by the end of this chapter, describe deafness and hearing loss as it relates to a child's overall development and what teachers can do to support the child's development. Also, we should be able to discuss blindness and visual impairments and outline characteristics of an appropriate early intervention program for children who are blind or visually impaired. So think about what you already know. What are some of your guesses about these concepts? What's your prior knowledge? And then it will be expanded upon as we go through the chapter. Deafness and hearing loss. Deafness refers to a hearing loss so severe that the individual cannot process spoken language even with amplification devices. So we covered this a little bit in the last chapter. And then the distinction between deafness and hard of hearing. Hard of hearing refers to a lesser loss, but one that nevertheless has a definite effect on social, cognitive, and language development. There are different types of hearing loss. So we have conductive, sensory neural, central deafness, and combined loss. So first, let's talk a little bit about conductive hearing loss, and that is a loss in the outer or middle ear. Then we have sensory neural hearing loss, which is a loss in the inner ear or cochlea. Central deafness, a loss in the higher auditory cortex. And then combined loss would include a loss in two or more of the above. So take a look at this pie chart above me, and you can kind of see a breakdown. This comes from the League of Hard of Hearing, and this gives you a breakdown of some of the causes of hearing loss. So you can see that some of the bigger pieces of the pie would be from prolonged loud noise, industrial deafness, that's 33.7%. 28%, unfortunately, is due to age. My friends and I call it symptoms of maturation. That's our euphemism for getting older. Other would be 16.8%. The top green section is infection or injury, 17.1%, and about 4.4% of the population is born with hearing loss. So some interesting statistics about the causes of hearing loss according to the League of Hard of Hearing. What are some warning signs of hearing loss? So for parents or caregivers or teachers, these are some things that might alert you to thinking about getting a child having a hearing screening or taking them to their pediatrician. So one warning sign might be lack of response to environmental stimuli. So you hear a loud noise, or they're not responding to voices or their name being called, or maybe something that they used to respond to, maybe a favorite song they're no longer responding to. So lack of response to environmental stimuli. If they tug on their ear, so if you have a child who's constantly tugging on their ears, that could also be an indication of hearing loss. They used to talk and respond, and now they do not. So noticing a regression in the verbal communication. Drops initial consonants. So in words, whatever the first initial consonant is. So for example, boy might be oi instead of boy. Oi. Dropping the initial consonant can also be a sign of deafness and hearing loss. Seeming inattentive. My son Noah, about a year ago, we noticed that he wasn't responding when we would call his name, especially when his back was turned to us. And at first I thought, maybe he's purposely ignoring me because he doesn't want to do what he thinks I'm going to ask him to do. But when I would say things that normally he would respond to, hey Noah, do you want to go outside? Hey Noah, let's go pick a book. And he didn't respond. And then I heard the same from my mom, who was also watching him. Then we were concerned. Luckily, it was fluid in his ears, which was something that we could resolve with antibiotics. But because we noticed that he seemed inattentive and he wasn't responding to stimuli that he was previously responding to, that was for us a red flag. And so we were able to get that treated. Another sign would be a child who looks confused when they're being given directions and turning their head to one side to hear better. So if you notice something like this, if the sound is coming from this way and you're noticing them turning their head or leaning into the sound, that could also be a warning sign of hearing loss. What is the impact of hearing loss on development? So one primary one would be effect on language development. A child who cannot hear sounds during the critical period may never master those sounds. So think about children in these extreme cases, children who are isolated, these cruel neglect cases that you hear where children are isolated and they're not talked to. They're not hearing sounds during this critical period, and so they're not able to mimic and echo those sounds and practice their language development because they're not taking in those sounds from their environment, so they're not able to duplicate those sounds and develop language. Language delays are probable. Parents and caregivers may stop speaking to the child because he or she cannot hear them. So think about that kind of domino effect. If the child is not able to hear, then the parents and caregivers may stop speaking to them. So that's something to really think about if you have a child who has hearing loss, to continue engaging and continue giving them that interaction input and to stimulate their engagement. Effect on cognitive development is another factor for deafness and hearing loss. Language and cognitive skills go hand in hand. So think about the relationship between your language skills and your cognitive skills. So one thing to consider, if children are behind in language skills, they are more than likely going to be delayed cognitively as well. Children with little or no hearing tend to be years behind their normal developing peers. So think about all of the things that you've learned in your childhood. I know we have to think way back for that for some of us, and how that learning experience would have been different if you were not able to hear in your environment. So if you were not able to take in sounds and associate those sounds with things that you're seeing and things that you're experiencing, being able to mimic sounds that you hear, imagine all of that's taken away and how that would impact your cognitive development as well as your language development. There's also an effect on social development. So oftentimes children who are experiencing hearing loss or deafness may be impulsive, aggressive, or have low self-esteem. They can often be shy and withdrawn. Unintentionally, they are often left out because hearing is so much a part of our world. Difficulty establishing friendships or entering into conversation. So think about ways that you can provide inclusive opportunities for children, perhaps in your classrooms, children that you work with, children that you encounter, and how you can provide inclusive activities and opportunities so that we can try to avoid some of these effects on social development. Also, there are effects on family life, frustration, lack of time to learn new methods, difficult to establish behavior limits, and family therapy and counseling can be one way to hopefully remedy some of these effects on family life. There are several different types of communication for children who experience hearing loss or deafness. One is speech reading. That is when children learn to read your lips while you talk. So lip reading or speech reading. The other strategy is called cued speech. This is a system of hand shapes and mouth movements in which the child learns the combinations to understand the spoken words. It's a bit of a hybrid. Then we have American Sign Language, ASL. So ASL, hopefully I did that right. A language that consists of hand movements with or without speaking. And I highly recommend, if you haven't already started to explore ASL, it's a great tool to have, especially working in an early intervention setting. Even children who are not hearing impaired benefit from ASL. Sign language is something that is used in infants as well to help them communicate pre-language. And then we have total communication, combines speech and sign. Which method is best? Well, it is a family preference. No one method has been proven to be the best. So it's really up to the family and what works best for them. And it could very well be a combination of some of those different methods. So no one is proven to be the best. It's up to the family and what they prefer. Early intervention is key. Cannot stress that enough. As with all disabilities, the earlier the intervention is begun, the better. And I'm going to repeat that. The earlier the intervention is done, the better. And early intervention technically is considered from birth to age 3. So it's really quite a small window for a parent or caregiver or a teacher to notice an issue and then get services provided, like from the regional center, for example. Those would be considered Part C services, and Part B services would be after the age of 3, which sometimes, unfortunately, are harder to get depending on the service provider. Language learning is highly important. So we know from earlier foundational child development classes that our language is developing, even prior to birth. And after birth, we have these very critical periods of learning language. And so language learning is highly important. Therefore, for early intervention would be key. Children need to learn to use what residual hearing they do have. So taking what they have and being able to capitalize on that to try to navigate in their environment and adapt to their surroundings. So again, early intervention is key. Here are some guidelines for teachers. One is to get down on the child's level. And this is a tip that I think teachers and parents tend to do naturally, but it's something important to keep in mind when working with children who might be have hearing impairment. So getting to their level, sitting close to the child when you're speaking to them, make eye contact, use short, simple sentences, and use concrete examples. So trying to eliminate analogies and metaphors and figurative language and slang, trying to use as concrete examples as possible. There is some assistive technology that is available. One would be amplification devices and hearing aids. These are modeled to fit the child's ear. Some problems can be bad fit, batteries die, feedback, those echoes that we hear sometimes with microphones and such, on and off switch, sore ears, having those might actually hurt the ears. Another example would be FM system. The child wears a receiver and the teacher wears a microphone. So I've seen that with children, for example, where the child will wear a little device that maybe they can clip to their shirt, and then the teacher has a microphone and can speak into the microphone, and then it's amplified and that the child can then hear it. And then there are alerting devices which communicates to the child through vibration or lights. I included this graphic. I thought it was pretty interesting. If you take a look at the visuals here, this talks about teen hearing. Most teens are engaged in dangerous listening habits. Dun, dun, dun. So if you take a look at some of the statistics here, nearly half of teens showing potential signs of hearing loss, so 46%. And this would be indicated with ringing, roaring, buzzing, or pain. 1 in 6 teens have symptoms often or all the time. So that's about 5 students in the average classroom. Towards the bottom, breakdown of teens with at least one symptom often or all the time. 12% ages 13 to 14. 19% ages 15 to 17. 17% ages 18 to 19. Sorry, I was looking the wrong way. Should be looking this way. Sorry. And then risky habits on the top. Teens know that there are risks and are still leaving their hearing unprotected. 88%, nearly 9 in 10 teens engage in at least one risky hearing behavior. 81% listen to loud music with earphones. We know that that's really prevalent with young people listening to earbuds and earphones. 21% use mowers and other loud tools, and 16% use noisy power tools. So interesting just to keep in mind with our young people and how they're exposing themselves to potential risks for dangerous listening habits, and that can potentially damage their hearing. So now we're going to shift from hearing impairments to blindness and vision impairments. Blind is defined according to the text is visual loss so severe that it is not possible to read print. So it's not possible to read print. And then we have a little bit lower on the continuum or higher, low vision. Residual vision is sufficient to allow a child to read large print or possibly regular print under special conditions and to use other visual materials for educational purposes. So similar to our deafness and hard of hearing, on a continuum, one is more severe than the other. Total blindness would be inability to distinguish between light and dark. Most children can see some light and shadows. Most children who have vision impairments can see some light and shadows. So total blindness would be the inability to distinguish between light and dark. So the absence of being able to see light and shadows. There are some types of vision problems. So for example, we have physical abnormalities. Those would include conditions such as cataracts, glaucoma, retinopathy of prematurity, cortical blindness. I mentioned last chapter, my son Colson has cortical vision impairment, and in fact today he had a vision assessment from folks from the district who came into his school at the Blind Children's Center and did a vision assessment so that they can determine what sort of services would best meet his needs. There are also visual acuity problems such as refractive errors, astigmatism, myopia, and hyperopia. So muscular abnormalities could include things like strabismus, sorry about that. For example, you can see my son Noah, he had eye surgery because he suffered from strabismus, which you might call it like a wandering eye, wall eye, lazy eye. You can see in the picture that he had pretty severe strabismus. Mostly it was in the left eye, but it sometimes would switch between both eyes. And so we would have to do patching, and the patching of the stronger eye to help strengthen the weaker eye. So even after the eye surgery, Noah still has slight strabismus. The ophthalmologist told us that it might not 100% correct it, but it's better. But we still notice it, especially when he's tired or when he's trying to focus on things from a couple of feet away. Amblyopia is another one, and nystagmus. Nystagmus is when you have eyes that go from side to side very, very quickly. That would be an example of nystagmus. How do we identify vision problems? So again, as parents, caregivers, teachers, etc., here are some things to look at to be able to determine that there are vision problems. One is lack of eye tracking as an infant. So when you put an object, normally you put an object in front of an infant, if they're able to track and follow, especially something that's high interest for the child, they would follow it. So lack of eye tracking would be something like this. The object, you're moving the object and the eyes are not following. And this may go undetected until a child is in school. A few tests are available for the younger child. Some examples of those tests would include Snellen Illiterate E test, teller acuity cards, and photo screening. Children often do not know that they have a problem because they do not know what they're looking at. So it's kind of a catch-22. So the child might not even be able to realize that they have vision problems because they don't know that they're not seeing things the way that they should be seeing them. Here are some warning signs to look at. Rubbing of eyes, closing one eye, watery or itchy eyes that are not allergy related, inability to see or squinting, and blurred vision. And I think with a lot of these conditions, whether it's deafness, hearing impairment, vision impairments, when the child is pre-verbal, it's often hard to know because they're not able to express it to you. They're not able to tell you that they can't hear or that they're having difficulty seeing, especially if it's something that they were born with. They don't have any experience to compare it to. So that's why it's really important to observe and try to notice any changes or some of these warning signs to look for. And how do vision problems impact development? So there are effects on language development. Child cannot see objects, so they have trouble learning the meaning of spoken word. Children must be given time to explore concrete objects to learn meaning. So for children who have vision impairments, it's really important to provide a lot of hands-on experience, realia, things that they can touch to relay those concepts. So it's fun to think of ways to get creative in order to have a child experience something through touch. I remember watching a movie years and years ago, Mask, the story of Rocky Dennis, and he befriended a girl who was blind and she had never known colors. And so he was trying to give her objects to convey colors. And so I remember in the film, he let her feel cotton balls, and that was his way to convey white. So thinking of how can you use objects to convey meaning so that children can use the senses that are intact, like their sense of touch, to be able to convey something that they're not able to see. Effect on cognitive development. So there can be delays due to concept development. Usually they can catch up by about age 5 or 6. There is an effect on motor development. So children who have vision impairments, they may have delayed walking, delays in localizing sounds, difficulties in understanding their body and objects in space. So thinking about perhaps when you did your simulation activity and how when some of these senses are taken away and how that impacts, for example, your balance, your orientation, etc. The effect on social development as well. So these children tend to be quiet and passive, unable to participate in interactions that build social skills, and their play skills develop slowly. So think about that if there are vision impairments or blindness and how that can play a role in your social development and how that might impact your willingness to participate with your students and with your classmates, and that in turn may lead to you feeling withdrawn. Effects on family life. So many vision difficulties are due to prematurity. So premature birth may sometimes lead to vision challenges. Caregivers may have difficulty interacting with infants because the infant does not smile back or react during interaction. So I mentioned in a previous chapter about how important it is within those first few weeks for the parent-child bonding experience when the child is able to respond and give feedback, to emote, the baby smiling or the cooing, and how that is important to establish that bond between the caregiver and the child. So when there's a vision problem and the child's not able to do that because they're not seeing the caregiver and they're not able to respond in that way, that can challenge that bonding facilitation. Early intervention is key, remember. So early intervention problems, there are things such as orientation and mobility training. This is a must. It exposes the children to their environment. If things are not moved often, the child can learn independence and play and learn independence at play and clean up. How do we work with children with hearing loss in a classroom setting? So again, giving them concrete concepts, providing descriptions of objects, and providing rich vocabulary. All good strategies for teaching children with vision loss. And more guidelines for teachers: use words for everything. Be specific. Let the children discover through touch. Put different textured fabric at each center, identifying the boundaries. That's pretty cool, right? So that the child can feel where the boundaries are for the center. Make use of residual vision. So write words extra large and in bold colors. Okay, making things stand out, enhancing their experience with objects through touch. So back to our objectives revisited. So back from the beginning of the chapter, now that we've gone through this information and you've reviewed your notes and your PowerPoint, how are you able to Describe deafness and hearing loss as it relates to a child's overall development and what teachers can do to support the child's development. Also, discuss blindness and other visual impairments and outline characteristics of an appropriate early intervention program for children who are blind or visually impaired. So think about the new information that you have. Add that knowledge to your prior knowledge from the beginning of the chapter, clarify any misconceptions, review any key terms from the chapter that may be unfamiliar to you. Thank you for watching. See you next time.